My name is Joseph Dayan. I'm a plastic and reconstructive surgeon specializing in facial paralysis, and I work at the Institute for Advanced Reconstruction.
Lakhiani. I'm also a plastic and reconstructive surgeon. We're trained in reconstructive microsurgery, and we work for the Institute of Advanced Reconstruction, treating patients with all forms of facial palsy. When patients come in for surgery with us, one, they should expect that we've spoken with them generally multiple times, that they've fully understood what has caused this, what steps we can offer them reasonably, what they might expect afterwards. In addition, we may have discussed with them the need to do more than one operation. So that is part of our discussion as well. After any of these procedures, expect that there will be some facial swelling that may last for several days or even weeks. In certain of our procedures, you may or may not need a drain. But in general, these are so highly tailored to the individual that every person is different, and we really try to make this as unique and specific to the person as possible.
I would say most of these procedures the largest procedures are overnight in a hospital. Recovery is about a couple of weeks. They're generally, while they can be long procedures because we're working with microscopic sub-millimeter nerves, it's long because we're doing very delicate things. It's usually not long because we're doing highly invasive work.
After your surgery, it's important to remember that there's two types of recovery we talk about. One is recovery just from the procedure, having your scars heal and your swelling. In terms of nerve surgery, the scar that most people have is something very similar to a facelift type incision. Generally, that's an incision that's well hidden around the ear. Recovery in terms of your function from the nerve procedures, now that is separate and that takes months. So after you are healed from your surgery in terms of your scarring, you still will require several months until we see visible changes in the results of the nerve surgery. So it's important for folks to know that, to not get really discouraged, because we don't expect these techniques to really start even kicking in and becoming effective. And like Dr. Dayan said, it starts with a flicker. And that flicker is really exciting to watch turn into true motion and dynamic motion over the course of several months to a year.
I would just add, regarding nerve transfers in particular, like a nerve to masseter transfer, which is transferring the biting nerve to the facial nerve, usually to create a smile and some eye closure. Usually you start seeing some recovery at about 3 months, 4 months, something like that. In certain cases, it could be longer or shorter. Mini hypoglossal transfer, where you're hitchhiking on the end of the nerve moving the tongue, usually can take 6 or 9 months, where you're starting to see recovery. Cross-face nerve grafting, where you're taking nerves from the normal side and then tunneling a nerve graft to the weakened side, is a much longer procedure because the nerves have to travel a longer distance. There's more variability into how much power you get, but that's for like 9 months to 12 months. And then bringing in a muscle or rehooking that nerve up to its target muscle. And then that recovery time can be 6 to 9 months.
We have a real focus, always improving, tracking that data, sharing it with the scientific community to see how we can improve overall. And in this case, not only do you have one surgeon looking everything over, but we're both looking over everything in your care. And between the both of us, you'll always have someone available in order to help you answer questions, guide you along the process.
Having this partnership with Dr. Lakhiani is a blessing because we complement each other. We have one person can't do everything all the time in full capacity. I think having a very clear and rich outcomes research arm of this, actually tracking how people are doing on what time course and what we've done and how we can improve is really important in always getting better. We're in the company of great doctors, and we bring that to every single patient.